Hi everyone, Dr. Melissa here. So I am going to show you guys quickly in a quick video how you can reduce that nagging neck pain, low back pain, and especially the pain that goes into your arms and legs. So how many people have that pain that goes into shooting down a leg or into your toes, into the top of your feet, or down your arms or into your fingers? That actually is something called radiculopathy, meaning it's radicular, so it radiates down into limbs, and it's radicular pain. That is something that we treat all the time in our office. So I'm going to explain a little bit how it works and what we do for it. So here's a diagram of your body. You can see here there's different arrows. So this one is showing pain going up and down legs, and then this is showing pain here in the low back. So this is just talking about the low back or leg pain, but there's also, you can imagine this in your upper body as well. So here is something called central pain. So that means it's local right to the low back, and then right here, this is called radicular pain, so going down the leg. So what this, in our terms, in the world of chiropractic, if you are trained in something called McKenzie Therapy, we have two words for these. It's called centralization or peripheralization. So peripheral means far away. So here's periphery. It's going down into the leg, so going far away, or central, centralized here. So this is why if somebody comes into our office and they have pain going down into their legs, and then as time goes on, it just moves to the low back, and they're like, oh, it's still in my low back, but it's not in my leg anymore. This is actually a really good sign. That means it's centralizing to the midsection of their back, or the root cause of where the pain is actually coming from. So what does this mean? Where is it all coming from? So here is a picture of a vertebrae. So this is a bone. And then there's a picture of your disc. So this pain is something called discogenic pain, meaning a disc has shifted out of where it wants to situate normally, like here, it's shifted out into a danger zone. So it starts hitting on nerves. So here is, we call it a jelly donut. Here is that disc that sits in between these vertebrae. This literally is like a jelly donut. It can, if we squeeze this out, it would move and start shifting. Imagine a bunch of nerves that run up and down alongside this. As soon as that jelly donut gets squeezed out of there and starts hitting those nerves, that's what then causes this pain going down into the leg. So you have different plexuses that run all over your body. So you have a brachial plexus, you have a femoral plexus, you have different plexuses all over. This disc hits those nerves. Those nerves are what sits in the plexus, and then that causes that zapping pain down into the legs or down into the arms. You know, that's really sciencey and it's kind of confusing, but in lay terms, just imagine again a jelly donut, and here is the middle of the jelly. When all of a sudden, if you have a little bit of a shift and that disc goes unstable, it starts hitting the nerves on this side. Those nerves control this side of the arm, let's say, and then it starts affecting that nerve going all the way down. Our goal with McKenzie Therapy is to move that disc back into the proper location. So everybody has a different directional preference is what it's called. So you have to get the patient to move in the proper direction. So some people, their disc is moved, I'm going to turn this way. Some people, their disc is moved a little bit laterally or to the side. Some people, it's moved directly to the back. Some people, it's moved a little bit off to this side. We are able to figure that out through asking questions and through symptoms and things like that. So the most general thing we do first is start with just somebody moving into an extension position of their neck or their low back, which means extension is this way. And it's helping to shove that disc back into its proper location. Not everyone responds to that though, because their disc might be pushed out to either side. So then we have to progress movements. I have to use, physical force to help guide the movement. We have to change directions, rotate the head. Same thing with the low back. It then helps shove that disc back into its proper spot to get off of those nerves to decrease pain. And it's a process. You have to be really diligent with these moves, or else that jelly donut will slip right back out. Disc pain is very unstable, so it can shift and then go back and shift and then go back. So it's our job to be really diligent and stay on top of these movements to make sure that we're perpetually shifting that disc back into its proper location, so that way it doesn't slip back out and start hitting nerve endings. So again, I know it's a little sciencey, but that's just one of the things we do in our office, along with chiropractic adjustments then, to help the spine move even more freely, to help that disc slink back into its proper spot. So I hope you guys learned something now. If anybody has pain down into their arms and legs, you know why. And then you know how we fix it in the office. Okay, have a great night, everyone.